Now to still talk about COVID and to discuss from a regional perspective, which we'll be looking into Kenya. I'll be joined by Dr. Mercy Korir, who is a medical journalist, Standard Group, KTN News in Kenya. And of course, she will be telling us how they're handling it back in Kenya. Good evening, Mercy.
Good evening, Fiona. Very good to see you. How's you is RwandaTV?
Well, thank you for making time, of course, to be with us.
Thank you. Thank you for having me this evening.
Now, 246 cases, 11 fatalities, 53 recoveries. What does this graph mean for you, especially in Kenya?
I think what we are seeing is a gradual increase of the number of people who have been diagnosed to have the coronavirus. There's been a gradual increase of the number of people. We had a point where we had 20 to 29 people being diagnosed in one day, but this was as a result of the people who are in mandatory quarantine. But what we've seen since then is that our numbers are increasing marginally by day. So what we've seen from our graph is that we are growing slowly as opposed to the steep curve that every country is avoiding or trying not to get, because when the curve steepens and there is a spike in the numbers, then it causes a crash in the healthcare system. So I can say confidently that the Kenyan graph is stable as it is now, but this doesn't mean that we are safe yet. It doesn't mean we are out of the woods yet, because we need to increase the testing that we are doing in the country so that we are able to know as much as possible the extent of transmission of the virus across different parts of the country, so that mitigation measures can either be escalated to avoid further spread of the virus, or the measures can be de-escalated, and so that people can go back to their socio-economic activities, which are suffering the brunt of this coronavirus pandemic. Now, luckily also for the Kenyan numbers is that most of the people that we have diagnosed or that have been diagnosed in Kenya have had either been asymptomatic without any symptoms, or they have had mild symptoms or very moderate symptoms. So we are not seeing critically ill patients as are being seen in the global north, in countries in Europe, countries in North America. So we are seeing we are able to manage so far. So that's a good thing for Kenya. And if the other African countries report the same, then it means our healthcare systems and their weaknesses can somehow manage without being brought down to their knees by the coronavirus.
Yeah, absolutely. But Dr. Mercy, have the measures put in place been impactful? Because I'm looking at a case where social media are actually calling on the Kenyan government and said we need a total lockdown if we are to actually, cross that line and have to flatten the curve.
I think the measures have been several, and let's start from the first measure about just asking people to wash their hands with soap and water, running water and soap, asking people that if they do not have running water and soap to use sanitizer. That was one of the measures, and we've seen that just apart from preventing coronavirus, the other diarrheal diseases or the other diseases which are caused by many germs in the hands that the country has been able to to reduce. So that was one of the measures, and it definitely has an impact. The other one was on physical distancing, where people now are not allowed to go to any gatherings. Funerals, for example, are only allowed a maximum of 15 members who have to be close. Family members keeping distance of at least 1 meter. 1.5 meters, we've seen like countries like the UK is 2 meters, but at least 1 meter physical distancing that is happening, which helps to reduce the spread of the disease. We saw that schools were closed, which is one of the measures that, in schools, especially boarding schools where there is a gathering of students, there's a gathering of an influx of teachers here and there, so that was a fertile ground for spread of the disease. So we saw that happen. We saw some measures in our public service vehicles, reducing the number of people they could carry. So all of these measures have helped us to be able to delay the quick transmission of the virus and be able to contain. Now, when it comes to issues of lockdown, we've seen that the government here in Kenya instituted a curfew between 7 p.m. and 5 a.m. so that people who would otherwise be going to entertainment joints or meeting other people after work, then that is not happening, which is one of the other measures. So we could see that these measures are slowly being escalated depending on the data that is coming into the government, depending on the information that the government is able to get from its surveillance, so that now if it comes to a time when they're saying we are locking down the country, then it's based on some data somewhere. The counties that have been locked are the cities of Nairobi, Mombasa, and Kwale and Kilifi. These are in our coastal area. These are the cities or the counties that had reported a significant number of cases. So these have been locked down so that now we reduce the number of people moving out of these particular places or people coming in and being able to, get the disease, because there is already local transmission in the country. So some of these measures are working, and I imagine that if a total lockdown is warranted, then the government will definitely call it. But as it is now, seeing what our numbers are and where our transmission is, I think the measures that we have so far are working, and we're seeing an impact in the country.
Of course, but of course, Dr. Mercy, let's look at it in a regional perspective. We have some countries that have no curfews, and we're still in the same region, yet we have to flatten the curve, yet we want to have the borders open. As a medical journalist, what do you think needs to be done to ensure that, as the region, East African bloc, we are moving at the same pace?
I think this is high time for the East African community to collaborate and coordinate across different measures. Whatever is happening in Rwanda, Kenya, Uganda, Tanzania, for example, Burundi, all of us have to coordinate if we are to be able to contain the virus as a regional bloc. Because you can imagine, for example, if Kenya does not institute some measures, and somebody moves from Nairobi to Kigali, and they were asymptomatic, and by the time they come to Kigali, for example, they start developing symptoms, they will transmit the disease to people in Rwanda. So there needs to be a coordination and a cooperation between the East African community so that we are able to contain the virus, all of us together. Remember that our borders are, let me call them porous. When you have the official border crossing points, there are other points within the borderline where you can freely move from one country to the other one without necessarily being, being able to be tracked or being able to be found by the authorities. So I think it is time that we see the East African community cooperate and coordinate all their efforts, because at the end of the day, this virus that is a threat to Kenyans is an equal threat to the Rwandese citizens. So what we do in one country, we should be able to coordinate and do in the next country, because all of us are in the same region and are facing the same threat in equal measure.
Before I let you go, Dr. Mercy, briefly, Africa could become the next epicenter of the coronavirus outbreak. This has been warned, of course, by the World Health Organization. What are your thoughts on this? Should we be scared?
I think this is not to make us scared, but to make us step up our efforts so that what has been done in the Western countries, in the global North, we're able to quickly implement here and, be able to implement quickly so that we are able to contain the virus so that it does not become an epicenter. For example, if we are to increase our testing, then this is the time to increase the number of people we are testing so that we can quickly know the number of people who have tested positive so that we can isolate and contain the virus. So I think this is a call for the African countries to wake up and do something about it before it becomes a problem that we are not able to handle as a continent. So this is a call for us to act, not to be scared.
Thank you very much, Dr. Mercy Korir, for making time to be with us, and stay safe.
Thank you. You too.